Hello and welcome. Today we will be going over an orientation to Cornerstone. A quick orientation here for those of you who need a refresher about our program. The EPI-CAL TTA, or Training and Technical Assistance Center, is a program of EPI-CAL. It was developed by UC Davis, UC San Francisco, and Stanford University. We provide training and technical assistance to support implementation and sustainability of early psychosis programs across California. Our goals are to support provision of high quality early psychosis care to all Californians and to promote recovery and better outcomes through a learning healthcare network approach. On the right, you'll see a visual overview of EPI-CAL, including the TTA. EPI-CAL is composed of two programs, TTA and LHCN, or the Learning Healthcare Network. The Learning Healthcare Network is focused on harmonizing outcomes data collection across the state, whereas the TTA is focused on providing training and technical assistance to support implementation and sustainability of California early psychosis programs to improve client outcomes. Your county may be part of one or both of these programs. There are two funding sources that provide access to this program. EPI Plus, funded by the MHS-OAC through AB 1315 legislation, and MHBG supplemental funds, SURSA and ARPA, distributed by DHCS. Your county may receive one or both of these funding sources. Learning objectives. By the end of this training, learners will understand the purpose of Cornerstone, understand how to register and log into Cornerstone, understand how training records from previous TTA trainings will be incorporated into Cornerstone, know how to access the Learner Home welcome page and transcript, be able to access assigned training and curricula, learn about training exemptions, understand manager security permissions and functionality, and know how to access the Cornerstone user guide. So what is Cornerstone? Cornerstone is a learning management system, or LMS. An LMS is a software application for the delivery, tracking, reporting, and administration of educational courses, trainings, etc. Cornerstone will be replacing our current learning management system, Canvas. Please note this is only relevant to EPI Plus grantees or EPI Plus participants through the TTA, as those of you who are participating only through DHCS Mental Health Block Grant supplemental funds will not have used Canvas in the past. Cornerstone will also allow you to attend live and asynchronous or on-demand trainings. And Cornerstone allows you to take trainings specific to your role within your clinic anytime in the order they should be taken. Lastly, Cornerstone will track your progress in each training. Speaking of Canvas, some of you may be wondering why we are making the switch from Canvas to Cornerstone. Please note this slide will be relevant only to EPI Plus grantees. If you are not an EPI Plus grantee, please feel free to disregard. As you can see, Cornerstone provides many benefits that Canvas does not. Our goal was to streamline our training platform to reduce the burden on your staff as much as possible. As you can see in the table, Cornerstone includes automated dynamic assigning of trainings based on program role, integration of CME and CEU accreditation, tracking of training completion progress, manager access to employee records, reporting, and progress, incorporation of external training records, Zoom integration for virtual instructor-led training, or VILT, user-friendly interface, self-registration, and automatically issue certificates of completion. So let's talk about your learning path. Each employee in Cornerstone will be assigned what we will refer to as a learning path, which includes a suite of trainings in order. Each employee will be assigned a learning path. Our learning paths are designed in a specific order so that each curriculum builds on the knowledge and skills learned in the previous training. You must complete one training module before moving on to the next. We've created separate learning paths customized for each CSE program position. The due dates for each training are based off the hire date you enter upon registering. If you have any questions about our training or require any adjustments to your staff's learning paths, please reach out to us. Roles for which we have provided individual learning paths include clinic coordinator or program coordinator or intake coordinator, clinicians or therapists, family partners or advocates, peer partners or advocates, case managers, physicians, clinic leadership, which may include program director, supervisor, or medical director, or more, supported education and employment specialists or occupational therapists, administrative staff, physician assistants and nurse practitioners, and nursing or other medical support staff. A full overview of assigned trainings by role in Cornerstone will be available in the Cornerstone user guide, and all of this information will be accessible to you in Cornerstone as well as in the user guide. We actually have two exciting announcements in this presentation. The first is the launch of Cornerstone, and the second is the incorporation of CME and CEU accreditation within Cornerstone. We're now offering this accreditation for all licensures for 21 training modules through Stanford CME. Stanford Medicine is jointly accredited by the Accreditation Council for Continuing Medical Education, the Accreditation Council for Pharmacy Education, and the American Nurses Credentialing Center. You'll need to finalize the entire module to be able to claim credit. Instructions on claiming your credit will be provided at the end of each accredited training. You will not be able to retroactively earn CME or CEU credits for trainings you took before Cornerstone. If you wish to earn CME or CEU credits, you must retake the training through Cornerstone. As we noted before, one of the reasons we're making the switch over from Canvas is because Canvas was limited in terms of tracking completion of certain training modules and learning objects. We will walk through how to request an exemption from assigned trainings based on trainings you've already taken, and we will do our best to work with you. Please note this section is only applicable to current and former recipients of the EPI+ grant. We've been able to track some, but not all of our learners' training progress in Canvas. All records that we have will be uploaded into the system once your team completes registration on Cornerstone. If you're assigned a training that you believe you have already taken in Canvas and do not wish to retake this training, you can request an exemption. If we do not have record of your training completion, we will reach out to your manager for assistance. We have complete records of every attendee at our live training since the inception of our program. All records that we have will be uploaded into the system once your team completes registration on Cornerstone. If you're assigned a training that you believe you have already taken in Canvas and do not wish to retake this training, you can request an exemption. As a reminder, CME and CEU credits are only available in Cornerstone. Let's talk about trainings outside the TTA. If you've been assigned a training but would like an exemption because you have completed an equivalent training outside of the TTA, you can add an external training to your transcript and then request an exemption. Both requests will need approval from our admin team, who will work to review and approve them as quickly as possible. We will go over how to add an external training and request an exemption later on in this presentation. Let's talk about getting started with Cornerstone. Some general guidelines for using Cornerstone. Always use Chrome or Firefox as your internet browsers to access Cornerstone. Microsoft Edge, Safari, and Internet Explorer will limit functionality, and you may experience limited access or technical difficulties. Please take a moment to bookmark or save the login page for Cornerstone now. It is https://epical.csod.com. Registering. Please note in this presentation, we will be using the term clinic leadership and EP program managers interchangeably. Clinic leadership have already been registered. You were emailed your login instructions already and do not need to register. Reach out to jrwindhouse@ucdavis.edu with any questions or for troubleshooting. Managers were also sent a self-registration link for your county or program. This link will be the link all staff will use to register for Cornerstone from now on, so please hold on to it. All staff in your early psychosis program must register for Cornerstone so they can take EPI-CAL TTA training. Upon registering, staff will automatically be assigned trainings relative to their hire date based on their role within your clinic. You will be notified if your county or program's link changes for any reason. If you are watching this presentation as a manager, you should already have access to your Cornerstone account. All other staff. Register using the self-registration link from your manager. This link is specific to your county and program. If you would like to follow along with this video, you will need to reach out to your manager for your self-registration link. In the self-registration screen, you will be prompted to provide the following information. Email address. Be sure to use your work email address associated with your EP program. User ID. Use your email address. County or program. You can choose this from the flyout menu here. Hire date, which should be the date you began working with your EP program, which can be approximate, and your manager, which you will choose from a flyout list. Choose your program's team lead from that flyout menu. On the next 2 pages, you will be prompted to choose your position within your early psychosis program or clinic from a finite set of options using the flyout menu. Please be sure the information you provide is accurate, or you may receive training content that is not appropriate for your position, as trainings within Cornerstone are based on your position within your clinic. Then choose a password and confirm, then click Submit. Once you complete the form, an administrator will review your user record for approval, and you will receive an email once it has been approved, and you will have access. Let's talk about logging in. Once your request is approved, you will be notified via email and will be able to log in using your email and the password you created. You can log in at the URL we showed before, which is epical.csod.com. If you haven't already done so, please take a second to bookmark this URL for easy reference. If you do not remember your password, you can request a password reset using the Forgot Password function. Please go ahead and reach out to J.R. Windhouse at ucdavis.edu with any questions or for troubleshooting. Now let's talk about using Cornerstone. First, we'll talk about the Learner Home and Welcome page. Your Learner Home is the landing page within Cornerstone where you will be able to see all trainings in progress, view your transcript, view and launch curricula and training details, view your assigned trainings and due dates, search for training, and view the number of completed learning objects and hours. The Welcome page gives you a snapshot of your current training status, including your transcript, training in progress, assigned training, events calendar, and the search function. Let's talk about accessing transcript and trainings. Your transcript is a place where you can manage all active, completed, and archived training in Cornerstone. You can use your transcript to view training details and curricula, filter training status by active, completed, or archived, due date, and type. You can request training exemptions. You can archive trainings, search your trainings, and view your team. Accessing your assigned curriculum and launching trainings. You can access your assigned training either in your Learner Home, Welcome page, or transcript. You can access any curriculum by clicking the Open Curriculum button. Once you've clicked Open Curriculum, your screen should look something like this. This is the name of your curriculum or learning path, which, as you can see, is specific to your role within your clinic. This is the current module. As you can see, it has a launch button next to it. You can click this button to launch the training and begin taking it. This includes individual training modules in the order they should be taken. And lastly, these are each of the learning objects within the training module. Once you click Launch, you will be taken directly to the training in a separate window. Click Start to begin the training, then click the Back or Next buttons to move forward or backward. Then proceed through the full training. Once you complete the training, you will see this screen, and you can then exit out of the pop-up window by clicking Done. The curriculum page will refresh, and you will be able to launch the next learning object. You will also receive a confirmation email. You must complete each learning object in the training module before you can launch the next. Similarly, you must complete each training module in the curriculum before you can launch the next. Let's talk about using the Mark as Complete function. While some learning objects will automatically be marked as complete, some learning objects such as materials or reading assignments will need to be manually marked as complete before the next learning object will be available for launch. To do this, after reviewing the learning object, exit out of the learning object pop-out window and click the Mark Complete button. This button will only appear after you have reviewed the learning object. Once you've clicked Mark Complete, the launch button for the next learning object will appear, and the training status will change from in progress to completed. Accessing completion certificates. Once you've completed a whole training module, you will receive a completion certificate, which you can access, download, and save for your records at any time. This will only be available once you complete the full training module, not individual learning objects within a training module or curriculum. This completion certificate is different from your CME or CEU credit. To access your completion certificate, go to Learning, view your transcript. Under Filter by Training Status, select Completed. Next to the completed curriculum, this icon, you would like to access a certificate of completion for, click View Certificate. Your certificate will then open in a separate window where you will be able to download, print, save, etc. Let's talk about virtual events. Our Cornerstone system is integrated with Zoom to provide live virtual instructor-led training, or VILT events. These virtual events include training, consultation, discussions, etc. These will be held directly on Cornerstone. To view your events calendar, go to Learning Events Calendar at the blue bar at the top of your page. Here, you can view events and filter by events for which you are registered or all events, title, instructor, subjects, day, week, month, etc. To see details of an event, click on the title of the event. A screen like the one below will appear. An event may have one or multiple live sessions. Once you are assigned an event, you will need to select the session you would like to attend from a list of available sessions listed under Parts or Schedule. If there are no available sessions, you will be notified via email when one becomes available. Once you've been assigned an event as part of your curriculum, you will see it in your learner home, welcome page, and on your transcript. In the examples below, the name of the event is Testing Zoom ILT Functionality. From any of these locations, choose Select Session or go to the event page. On the event page, choose the drop-down arrow next to View Details and then click Request. You will then receive a quick pop-up notification confirming that your request has been submitted. You will be automatically registered for this training and you will see your status change to Registered. You will now see this training in your events calendar under both All Events and My Events. In this example, the event has recurring weekly sessions and therefore shows up more than once. After registering, you will receive an email reminder about the event 1 day, 1 hour, and 10 minutes beforehand. Once you're ready to join the event, you can click the Launch button from the event page, which you can access by clicking on the name of the event, click View Details, then click Launch from your learner home, transcript, or welcome page next to the title of the training. Once you click Launch, Zoom will open and you will be able to join the session. Please note, if you try to launch the session before the start time, you will receive an error message like the one below. Tests. Many of our training modules include tests to test your knowledge of each subject. After submitting your final answers for a test, you will be able to view the passing score, your score, and whether you passed or failed. To review the correct answers and explanations to the answers, click the review link next to Review Test. You can then filter the test questions by correct, incorrect, and then toggle the Show Details checkbox. The answer explanation and correct answer will be shown next to each question. You must pass a test before you can move on to the next learning object. Please note, some tests can only be failed a certain number of times or the curriculum will be reassigned to you. Adding an external training to your transcript. If you have been assigned a training but would like an exemption because you have completed an equivalent training outside of the TTA, you can add an external training to your transcript. Navigate to your transcript by going to Learning, View Transcript in the blue menu bar at the top of the page. On the transcript page, click the 3 dots on the right-hand side and select Add External Training. On the Add External Training page, complete the form with information about the training you would like to add to your transcript. Once you complete this form and hit Submit, you will see it on your transcript. Our administrative team will work to review and approve this external training as quickly as possible. Once your request has received approval, the status on your transcript will change from pending completion approval to completed. If you would like to request an exemption from a training you were assigned in Cornerstone based on this external training, you will need to use the Request an Exemption function. Let's talk about requesting exemptions from assigned trainings. If you are assigned a training that you have already taken with the TTA or an equivalent training outside the TTA, you can request an exemption. You can request an exemption from a single learning object, such as a quiz, reading assignment, test, online video, etc., or an entire curriculum. You will not be able to retroactively earn CME or CEU credits for trainings you took before Cornerstone. If you wish to earn CME or CEU credits, you must retake the training through Cornerstone. Let's talk about requesting exemptions from assigned curricula. Navigate to your transcript from your home screen or go to Home, Universal Profile, Transcript. Click the arrow next to the Open Curriculum button and select Request Exemption. Complete the request exemption form, choose a reason from the Indicate Reason dropdown, and provide an explanation on why you're requesting the exemption. You will receive an email confirming that your request has been submitted, and the administrator will review and either approve or deny your request. You will receive confirmation when your request has been granted, or a follow-up email if your request is denied. Once your exemption is granted, you should see the status when you launch your curriculum, and you will be able to proceed to the next assigned curriculum. Let's talk about requesting exemptions from a learning object within a curriculum. Navigate to your transcript from your home screen or go to Home, Universal Profile, Transcript as we did in the last section. Next to the title of the learning object, click the blue drop-down button and select Request Exemption. Repeat the steps from the last slide. Let's talk about manager permissions. In this section, we will cover functionality that is specific to managers or clinic leadership. If your position is listed as clinic leadership in Cornerstone, or someone selects you as a manager in self-registration, you are considered a manager within Cornerstone and therefore have inherited security permissions that grant you access to things like employee records and transcripts, tracking, reporting, and assigning trainings. If you hire any new clinic leadership, please have them select clinic leadership when they self-register using your county or program self-registration link so they can inherit these security permissions. Let's talk about managing employee learning and viewing employee transcripts. In the blue menu bar at the top of the page, choose Learning, Manage Employee Learning. This will allow you to manage any pending requests and manage the transcripts of any of your employees. Assigning trainings. Managers can assign trainings to employees that they have not already been automatically assigned as part of their learning path, or that you would like them to retake. In the blue menu bar at the top of the page, choose Home, Universal Profile, then click the View Team button at the top of the page. Click the name of the employee you would like to assign a training to. At the top of the page, click the three dots next to the View Team button and select Assign Training. From here, you can search for whichever training you would like your employee to take, including events, curricula, tests, materials, online classes, etc. Not all trainings may be suitable for each employee. Employees may not be approved for every training. Please ask your TTA consultant what the most appropriate action is. Viewing employee reports. At the blue menu bar in the top, go to Reports, Standard Reports. This will allow you to pull reports for training progress for all employees who listed you as a manager. Note, if an employee did not list you as a manager by mistake, you will need to contact an admin to edit their user record. In reports, you can choose no-show details for VILT events, past due trainings, past requests, pending requests, records, session withdrawal, training progress pie chart, training status summary, and transcripts. Click whichever report you would like to run and filter however you would like on the Report Criteria screen. You can pull reports in the form of pie charts or more. Let's talk about the Cornerstone User Guide. The Cornerstone User Guide is a manual that will provide a more comprehensive overview of how to use Cornerstone for both managers and employees. The user guide will be available on Cornerstone, Canvas until sunsetted, and Box. A copy is available in our Box Resources folder at linktree/EPTTA. We encourage you to take a look at this user guide after this presentation. The last day to access Canvas for EPI Plus grantees will be May 31st, 2023. Starting June 1st, 2023, Canvas will no longer be available. We will also be sunsetting the training manual on this date. Please plan accordingly and have your staff registered for Cornerstone as soon as possible. Learning Healthcare Network participants will have access to Cornerstone for Beehive trainings in the near future. We will update you when this becomes available. We want to thank you in advance for your patience. Cornerstone is new to us too, so we may experience some bumps in the road that require troubleshooting. Thanks for your time. For any additional questions or troubleshooting, please email jrwindhouse@ucdavis.edu.